And we're back with REVOXYLIFE with me, Dr. Evie, on Bold Brave TV. And as you know, we have a very exciting, edifying, interesting guest with us today, Dr. Jannette Thompson. We've been talking about her path from Jamaica, training in Jamaica in medicine, and then, of course, migrating and then practicing in Canada, and how competitive that was, her passion, divine intervention, all those little just nuts, gems, nuggets that we still will need to assimilate and marinate upon at even after the show has ended and rewatching it again. But I want to move on in the interest of time. So uh tell us more about the field that you have now transitioned into, holistic medicine, bioidenticals. How did that transition actually occur? And so on and so forth. You can just take the wheel on this one.
Okay, perfect. Well, yeah, so I was practicing family medicine, chugging
Mhm,
along,
mhm,
but then I began to develop some health challenges. I think
mhm,
largely in part due to the fact that I was burning out.
mhm.
Family medicine is very, like, particularly in a environment of socialized medicine, it can be
Ah,
particularly challenging. And lots of time constraints,
mhm,
um, controlled particular heavily controlled remuneration, a lot of paperwork, etc.
mhm,
um, and an inability to really have the time to connect with
mhm,
people, right? And
mhm.
that for me is very important. So basically it didn't feel authentic to who I
Yes.
was. That type of practice, the assembly line medicine type of practice, didn't feel authentic, didn't align
Mhm,
with my values as a practitioner. And so naturally you begin to burn out when you're not in alignment with what you're supposed to be doing.
with who you
And
are. Yeah. Mhm.
yeah,
Yeah.
so
Mhm.
that's exactly what happened. I developed some health challenges, and so I was forced to stop. But fortunately, I'd done the courses to around that time. I said, let's see what else we can do. So I did
Mhm.
the courses for the bioidentical hormone training,
Mhm.
restoration training, and on a recommendation from my naturopath, who was, she
Mhm.
suggested, oh, maybe this might be something you'd be interested in, basically seeing who the kind of person I was.
Yeah.
And so I did the courses, and I tell you, that was a transitional point for me in my life. And that's
Mm.
when I started to baby steps, started to see a few people and to administer the hormones. And initially, of course, I'm used to a certain way of practicing. I'm used to, it's just about the prescriptions and getting
Yeah.
people on the stuff, and looking for results. Um, but then a whole nother component started to emerge from
Ah.
that practice. It started to realize that you became sort of, there was a whole nother side of the person or the patient that I was now able to get to know, to understand, because of the limitations in family medicine with time constraints. I
Mhm.
was able to do a proper enough of a history, enough of getting to know who the person was. And what I was starting to realize, that who the person was a big influence on how their life, what sort of challenges they had, you know.
Yes. Yes.
So then it made it easier to actually treat these people, and to, have more success in treating them, because you were able to get to know them. And
Mhm.
and so that's basically how I got into this field. And I'm growing every day in it, because there's a whole nother side, a whole nother, apart from the physical, there's the mental, the emotional, and of course the spiritual, which is probably what, you know which is very important, which is often neglected in conventional medical practice.
Absolutely.
um yeah.
Yes. Yes. And we've
So
talked about that a lot. It's so interesting. Again, oh, so many nuggets. Oh my gosh. I don't even know where to start. This is just so rich. So you mentioned a few things. And In particular, what I found really interesting is the practice of it, specifically socialized medicine. And just when you mentioned the assembly line, and
Mhm,
it doesn't bode well, didn't bode well for you, because what you wanted to do is to connect with your patients. So
mhm,
when you are waking up every day wanting to do what you do with the passion that you exude, and you cannot do
mhm,
that, then yes, there is a wear and tear. We know that the physical and the spiritual, and the mental are all connected, right? And so,
mhm,
interestingly enough, it has a lot to do with who you are as a doctor. So when you have all those notes exactly to catch up on, you don't have to play catch up if you're the type of physician who doesn't want to sit and connect with the patient eye to eye, right? Because I
mhm.
experienced that too, where you sit and I'm not writing notes while I'm talking to my patient, right?
Right,
I
right.
am I
Absolutely.
am directly, I am reading their body language while I speak to them. As you so clearly stated, you get to
Mhm,
know them and their family members too. So what you really wanted to do is what I say in my book. This there's this sanctuary. It's your silo. It's your time where you connect on a level that is beyond medicine,
mhm,
right?
mhm,
And
mhm.
you were hungry for that because that's what was
Yes.
deposited in you, and that's what you
Mhm.
needed to do, right?
Yes.
So,
And
wow,
and
wow.
that's fundamental to you being not just a doctor but a healer. You know,
Yes. Mm.
because medical being a conventional physician, there's certain limitations in just what you can do, in order to really make a difference in a person's life. In other words, to bring that healing that individual needs, you really need to be able to connect. To
Oh, yes.
connect. Yeah.
Absolutely. And they also have to feel that as well.
Yes,
They
they have
they, they
to
can't,
feel it.
exactly. They
Mhm.
It needs to be mutual, right? So
Yeah.
they admire you as the physician helping them, but they also know that beyond that, you care about when they walk through these doors outside of the
Mhm.
building, what's occurring to what they're dealing with outside, and how you can best be able to manage that in a way where they know that they can always be open to talk to
Mhm.
you about their challenges. Wow,
Yes.
that's so admirable. And that's difficult for you to train for so long and go through
Mhm.
all that competitiveness, in
Yes.
Canada. And that change must have been really difficult. But again, you were primed because of the passion
Mhm.
and the drives that you have.
Yes, and I
Wow.
think life just led me in that direction. It put it like I was as if I was being guided, and I
Yes.
even I look at the health challenges that I've had, because I've had a few more pop up over the years, even before
Mhm.
transitioning.
Mm.
Um, they help me to be the patient, to know what it's like, what it's like to
Mm.
be on the other side. They bring forth a level of empathy that you
Mm.
perhaps might not have had if you didn't have those experiences.
It's
You are
true.
able to feel what the person is feeling. Therefore, it really helps you to be able to help them, because
Yes.
you've been there, and so it helps you to be honest. So even though the health challenges could be considered as negative, but in a sense they're positive from this perspective, where it brings me to a whole nother level
Yeah.
of practice, a more fulfilling level
Ah.
of practice.
Yeah.
You know.
Yeah, that's the word. It sounds like you're very fulfilled, and it's authentically you, just as you stated. You know what's interesting? Oh, gosh, again, just so rich. What you mentioned that, this path that you took, it appears that you were being guided. And here's the interesting thing. I know it was probably really difficult, but
Mhm,
he works all things together for good, right? So you wouldn't have
mhm,
chosen the health challenges, right?
mhm,
And you
mhm,
didn't plan it this way. And there's no way that you can
mhm,
plan a better strategy for your
Mhm.
life than
Mhm.
Elohim. No way. No one
Mhm.
can. And so I completely believe that you were absolutely guided. And the things that you have to go through, they're difficult and you can't choose them. But when they are presented to you, it's his way of saying, okay, change your path. This is the path
Mhm.
I have
Yes,
ordained for you.
for you. I
Oh,
agree.
beautiful. That is so beautiful.
It's a way of, yeah, we have to, the messages keep coming to us in life, and we have to be aware of them, and accept them, and respond to
Yeah,
them. And, you
yeah,
know, we have
yeah.
to answer the call, when when necessary.
Yeah, yeah. It's the revelation. Isn't it amazing how you can live this life and you can have a revelation that
Hmm.
that just completely changes you, something that you experienced before, but you didn't extract the revelation from that experience until you were presented with another challenge. And then the light bulb moment sets in and you say,
Hmm.
oh my Lord, this is why, this is how, this is when, right?
Hmm.
It's so amazing. Like you said, it's the knowing.
It's
So
a no.
again,
It's
it's
workable.
the
Yeah.
knowing. It's the knowing. So I know that we've been talking for a very long time. I'm so happy that you have shared the challenges because I think it's important for not only patients, but any other professional, and certainly in the medical field, how difficult it is to be someone who wants to give complete care, right? Not just to prescribe
Mhm.
medicine, right? But to actually care for the entire patient, how difficult it is for someone to be in that environment. And,
Mhm.
it's hard to prosper when it goes against your very being, right?
Mhm.
Who you
Yes.
are. And I'm happy that you are now fulfilled. So, when we return, Dr. Jannette Thompson is going to talk to us about what she does now, bioidenticals, nutraceuticals, and how she applies these interventions in hormone management. So we will be right back in a few. Stay tuned.